Hi, I'm Dr. Pete Cambelos, and I'm a medical director at Buckeye Health Plan. When was the last time you paused to think about patient experience? And I get it, as clinicians, our days are full, and we're running between exam rooms and answering calls, charting during lunch, and trying to make sure really no one falls through the cracks. So adding meaningful patient connections into a packed 15-minute schedule can really feel overwhelming. But here's the thing, you can't have healthcare without care. And in our experience, those moments that feel personal, human, and connected, those are the moments that really drive best outcomes. They help patients trust us, engage in their health, and follow through. And so today, I'm joined by Dr. Tom Lehner, my colleague and other medical director here at Buckeye Health Plan, to talk about where we start with an enhanced patient experience.
Thanks, Dr. Cambelos. It's great to be here, and I appreciate the opportunity to talk about these things. This is really important, and I think this affects every part of our life as a clinician in our offices every day, and our staff as well.
Tom, let's kick things off with the shared understanding. And to me, patient experience really isn't about checking a box. It's about how we show up. So let's hear it from you. What does patient experience mean in your own words?
The patient experience to me starts when they pick up the phone and call for that appointment at the office. The receptionist that takes your call needs to be cordial and accommodating and making that person feel like they're important. And then when they come into the office, the person that checks them in at the window, then of course the nurse or the MA that puts them in the room, asking how they're doing, creating a very friendly atmosphere. And then when the doctor goes in, obviously that's very important that we give them our full attention and know that they're important to us, and that's why we're having this meeting today.
Tom, 100%. I echo everything you just said, and you're right. It's from that very first contact with the office. But, it's important that we make that patient feel like they're our only patient at that time.
Pete, I couldn't agree more. I think that, from the time we're in that room, there's so many distractions. You hear somebody next door, your phone rings. We all come in with a laptop with the chart on there now. And so I think it's important to make sure we make eye contact with the patient. The patient isn't the computer, the patient is sitting on the table. So I think it's important that we make sure that they know we're listening and we're interested in what they have to say. Active listening, I think, is really important. So if they say something, repeat the question and say, so did I understand you correctly? Or if I say something to them, make sure that they understand and have a chance to answer questions to me as well.
Tom, absolutely. One of the things I always do at each visit, I always end that visit by asking, do you have any questions? And I think that really means a lot to our patients to take that extra time. So how can we help our teams lean into this, Tom?
I think giving them ideas of how to make them feel at home and make them feel comfortable in our offices. Shortening wait times, for example. Communication. I think doing what you say you're going to do. If you say you're going to follow up with lab results, make sure that somebody calls them back with lab results. If you say you're going to call them a prescription, make sure that happens. I think nothing's more frustrating to a patient than you say something you're going to do and they have that expectation, and then for whatever reason, it doesn't happen. I think doing what you say you're going to do is probably one of the most important things we can do as physicians, but also members of our team doing the same thing.
Tom, that's great advice. And if you're watching this, know that the patient experience isn't just one more thing on your plate. It's part of delivering great care. Start where you are. Build one habit at a time. It does add up for your patients and for you. And once again, thanks for everything you do to support Buckeye members. And stay tuned for more real talk and simple tips in this series.